Teach you guys how to inject a B12 shot. And you can use any sort of injection for this modality. It's a deltoid injection. What we have here is B12. We have a tuberculin syringe. We have a drawing needle. This can be 18 gauge, 22 gauge, 23 gauge, doesn't matter. We're not going to inject ourselves with it. And then we have an injecting needle. This is a 30 gauge insulin needle, but you can use 27 gauge, you can use 25 gauge, whatever it is, right? If you're injecting testosterone, whatever it might be, doesn't really matter, right? We're gonna take an alcohol swab, we're gonna clean off the rubber stopper. Okay, we're gonna save this because we're gonna use it again. We're gonna punch through, that's the technique, 23 gauge needle. Plunge it through your rubber stopper, flip it up, and draw out what you need, right? So, for example, standard dose of testosterone would be 0.4 mLs, right, in a 200 milligram per ml vial. Every 5 days, it's a pretty standard dose. Cap that, toss this out, don't need it. Switch it out with your injecting needle. Again, punch it through like that. Push it on like a Lego. And then push the medicine up into the tip of the needle as so. Then you know it's ready to go. Take your deltoid, right? Here is the deltoid muscle. You guys should know this by now, right? If you guys are all weightlifting, as you should. You clean it off with alcohol, you let it air dry a moment, and then perpendicular, straight in, you pop it through the deltoid there. And then inject. Now if you're injecting an oil like testosterone, it might take longer than this, right? But about that speed is what you can expect, and you'll be pushing pretty hard too with an oil. But again, if that's too hard, you can always make the needle thicker, right? The thicker the needle, just the more painful the poke is, but the easier it will be to push the liquid through the needle. That's all. You take your needles, you dispose of them in a sharps container or even like an empty, gallon water bottle. And once that's full, you throw it out. All this stuff goes into the trash. It's one use only, you toss it out. You put your medicine in a safe area. This is B12, this goes in the fridge. Testosterone typically is not refrigerated. That's all, nothing to it. You guys can do injections by yourself at home. Thank you.